Just a few questions. First of all, when you go to vote according to what your constituents think or what you think is?
Generally, in the end, sometimes I've made tough calls where you go to your own gut and say, what is your best judgment? And I have the opportunity to be in committee hearings and read bills. And so you, as a member of Congress, sometimes you have a little bit more time to delve into an issue and go through it. In the end, people expect you to make your best judgment.
Well, then I think health cover treatment for congressmen who say one thing to their constituents and get amnesia when they go to Washington.
That's right. That's why I don't think we should create a government program unless every member of Congress is stuck in it.
Yeah. Can you please explain your vote for cap and trade?
I voted for the legislation after a long analysis that showed much of the legislation had been gutted. And bottom line, when I work with Midwest Generation, by the way, just about everybody in here, you get your electrons from Midwest Generation in Waukegan. It costs $14 per year per household. But when you look beyond the 10th congressional districts to the wider Illinois economy, we are overwhelmingly a manufacturing, agriculture, and coal state. If I'm to be a senator, I need to be the strongest advocate for all Illinois family incomes. And so I announced as a senator I would not support that legislation. John.
Hi. We're all here, obviously, because health care reform is very important to all of us. I live in this district, and we are one of the most educated districts, as you say, in the country. My peers seem to disagree with me quite a bit. Most of us did vote for you. The rest of them did not. Who voted for president? Hi. Okay. There we go. Battery's going. Now I've lost my train of thought. Healthcare reform is very important to me and my family. I just lost who Medicare. I'm out of range. Okay, there we go. So just because I'm younger than many people here, I have been following everything. And basically, my question is, we need some more marketing on this side. We're not getting it. And we need a voice for healthcare reform. We all agree, or most of us here agree, with insurance reform, litigation reform, all of that. I'm worried that we are going to lose this battle because, right now, there is not enough voice. I just want to get your opinion on where you think this is going to end up in the end.
I think that we should put forward a set of centrist reforms that lower the cost of health insurance and expands coverage for Americans without damaging the health care for seniors under Medicare or the 170 million Americans that already have a health care plan that they like. That's why we need national competition for health care. That's why we need fully electronic medical records owned by the patient. That's why we need to make sure that we have lawsuit reform to lower that unique thing, American defensive medicine, to stop, because we are the most litigious society on earth. All of those things are demonstrated to already lower health costs in some states and raise them in others who have no reform. And I think the kind of reforms that I'm talking about, with a pre-existing condition rule wiped out, with a look at obesity, with mental health parity, would receive about 3/4 of the congressional members' support and would actually do good for millions and millions of Americans to lower their costs.
Okay, Congressman?
Yeah.
I have so many things to say. I could talk for the rest of the afternoon, as probably most of us in here could. However, I do want
just
to...
let me give a warning, because we do have votes this afternoon in Washington, so we're going to have to, I will say, we're going to have to wrap up in 20 minutes. So.
Okay, I won't take 20 minutes. But I do want to say that my husband and I are self-employed. We are on single-payer insurance. We also are through, I consider paying for my own insurance single-payer. You look kind of perplexed, so what am I going to do with that? Okay, and we also are on the iChip programs. My son has a benign heart murmur. He is uninsurable. We are considered uninsurable. We are also on Blue Cross Blue Shield chip. We pay $26,000 a year for our insurance, and they don't cover everything. So we pay a lot of money for insurance. So I'm definitely for the single payer. I think it works. I pay a lot of money for it. I'd like to see that go down. And obviously most people couldn't afford to pay that. And unfortunately in the recession, we're at the point where we can't afford it either. However, my dad's on Medicare. Oh, here we go again. See if her technique works. My dad's on Medicare, taken care of very nicely in a nursing home. He has very bad dementia. Medicare works. Now, my kids used to go to a school where the old people from the society paid for the younger people's kids to go to school. And it worked very well. In other words, when you don't have a lot of money and you want to put your kids through school, the older people are picking it up. I think in this regard, we might have to do the reverse. We might have to have the younger people pay so our older people can be insured. The main point I want to make, though, is we can afford this insurance. We all have the money to help pay for it. Everyone in this room has the money. Give up one of your Starbucks. Give up a first. We all have money. And all I want to say, it is simple. And with you don't have insurance, you need to pay. Just think about it as a spiritual person. If you couldn't afford to help pay part of insurance for people who don't have what you have.
Just say, I don't believe we should raise taxes on the American people for spiritual reasons. Under the Caucus bill, we have a tax increase. We have a tax increase of $338 billion. By the way, remember in the Baucus bill, the taxes start right away, but the program doesn't start until 2013. There's $20 billion for everybody that taxes for everybody that doesn't have insurance. Most of the people in this room who are not on Medicare, but you have an employer-provided plan, you may fall under the $215 billion new tax on your own insurance plan. And then there's another $93 billion in taxes. $30 billion for medical devices, $45 billion for insurers, $17 billion for pharma. We would be naive to think that all of those institutions just pass on those costs directly to consumers, being higher prices. In the teeth of the Great Recession, I do not think we should raise taxes.
Yeah.